Feeling those leg aches and swelling more often? What if a simple, natural oil could bring surprising relief and get you moving freely again in just 1 week? Discover how. Many older Americans contend with persistent leg discomfort, including swelling, fatigue, and diminished strength. These common afflictions can significantly curtail mobility, impacting daily routines and overall independence for seniors. The cumulative effect of such leg problems can unfortunately lead to a more sedentary and isolated existence. The ability to move without pain is crucial for maintaining an active, fulfilling life in later years. When leg health falters, cherished activities, social connections, and even essential tasks become increasingly challenging. This gradual loss of mobility often leads to frustration and can affect emotional well-being profoundly. A promising approach suggests the possibility of revitalizing tired legs through a simple, accessible topical oil. This proposed oil application is designed to be easily incorporated into one's daily self-care routine at home. This method proposes a pathway to noticeable improvement within a relatively short period, specifically around 7 days. The focus is on alleviating common symptoms such as persistent swelling and the sensation of heavy, weak limbs. This accessible solution is presented as an option that does not necessitate immediate recourse to complex medical procedures. It also aims to provide relief without the burden of ongoing, expensive treatment regimens for many individuals. The potential for transforming leg health in such a time frame offers a beacon of hope for many sufferers. Imagine experiencing a reduction in discomfort and a renewed sense of lightness and strength in your legs. The primary goal is the tangible restoration of mobility, allowing for greater ease in everyday movements. This includes the ability to walk with more comfort, stand for longer durations, and engage in light activities. Regaining this physical capacity can significantly enhance one's ability to live independently and actively participate in life. Restoring comfort to your legs can translate directly into greater confidence and participation in social engagements. Beyond the physical benefits, the aim is to help individuals rediscover the joy associated with unhindered movement. This renewed vitality contributes to an improved quality of life and a greater sense of overall well-being. This straightforward method offers a potential means to support leg health using a readily available resource. Consider the possibility of addressing these concerns with a simple regimen designed for ease of use at home. This approach emphasizes natural support, aiming to enhance comfort and restore a measure of youthful vigor to your legs. The prospect of improved leg function can open doors to activities previously thought too difficult or strenuous. Embracing such a simple change could lead to significant improvements in daily comfort and overall life satisfaction. Consider this a proactive step towards maintaining your physical autonomy and enhancing your daily living experience. This particular method focuses on harnessing natural properties to foster leg rejuvenation and improve circulation. Many individuals over 60 experience persistent leg discomfort, a concern that warrants serious attention and understanding. These issues can significantly impact mobility, independence, and overall quality of life in later years. Understanding the underlying causes is the first step toward finding effective management strategies for these common ailments. Impaired blood circulation is a frequent contributor to leg problems as we age, affecting nutrient delivery. Arteries may narrow or harden, a condition known as atherosclerosis, restricting blood flow to the legs. This reduced perfusion can lead to pain, cramping, numbness, and a sensation of coldness in the limbs. Venous insufficiency, where veins struggle to return blood to the heart, also contributes to leg heaviness. Fluid retention, or edema, often manifests as swelling in the ankles and lower legs, causing discomfort. This can result from various factors, including heart, kidney, or liver conditions, or medication side effects. Gravity naturally pulls fluids downward, exacerbating swelling, particularly after prolonged standing or sitting periods. Persistent edema can make shoes feel tight and skin to become stretched and uncomfortable over time. Age-related muscle loss, termed sarcopenia, progressively weakens leg muscles, reducing strength and stability significantly. This natural decline in muscle mass and function begins subtly but accelerates after the age of 60. Sarcopenia contributes to fatigue, difficulty with stairs, an increased risk of falls, and general leg weakness. Maintaining muscle health through appropriate activity and nutrition becomes increasingly vital to counteract these effects. Chronic low-grade inflammation throughout the body can exacerbate joint pain and muscle soreness in the legs. Conditions like osteoarthritis, a common form of arthritis, involve inflammation and degeneration of joint cartilage. This persistent inflammatory state can lead to stiffness, reduced range of motion, and chronic leg pain. Inflammation often underlies many age-related conditions, making leg discomfort a complex issue to address effectively. Traditional remedies often provide only temporary relief because they may not address the multifaceted nature of these issues. Simple pain relievers might mask symptoms without correcting the underlying circulatory or muscular problems present. Generic exercise advice can be inadequate or even detrimental if not tailored to specific conditions like sarcopenia. Addressing leg discomfort comprehensively requires identifying and managing the multiple contributing factors often at play simultaneously. A singular focus on one symptom, such as pain, may overlook critical elements like fluid balance or inflammation. Therefore, a more integrated and personalized approach is often necessary for sustained improvement in leg health. Given the complexity of these leg issues, a thorough evaluation by a healthcare professional is strongly advised. Accurate diagnosis is crucial for developing an effective treatment plan tailored to individual needs and conditions. Proactive management can help maintain mobility and enhance the quality of life for older adults experiencing leg discomfort. Rosemary oil, derived from Rosmarinus officinalis, offers considerable advantages for maintaining lower limb wellness. Its application in addressing common leg discomforts is gaining deserved recognition among mature individuals seeking natural support. This botanical extract presents a valuable complementary approach to established conventional leg care practices for adults. Scientific investigations increasingly validate the therapeutic properties attributed to rosemary essential oil for leg health. Studies highlight its active compounds, such as rosmarinic acid and camphor, for their beneficial physiological effects. These components contribute significantly to its efficacy in promoting overall leg comfort and sustained vitality. One primary, well-documented benefit of rosemary oil is its capacity to enhance blood flow in the legs. Improved circulation can effectively alleviate sensations of heaviness and persistent coldness, often experienced in lower extremities. This circulatory support is particularly valuable for those with sedentary lifestyles or age-related vascular changes. Enhanced blood flow delivers vital oxygen and essential nutrients to leg tissues, thereby aiding their optimal function. Regular, gentle massage with appropriately diluted rosemary oil may contribute positively to better vascular health over time. Rosemary oil also possesses notable anti-inflammatory properties, crucial for managing various forms of leg discomfort. It can effectively help soothe affected tissues and reduce minor swelling associated with strains or overuse. This makes it a supportive agent for individuals experiencing persistent joint stiffness or recurring muscle aches. The inherent anti-inflammatory action can contribute significantly to greater mobility and an improved ease of movement. Applying it topically, when correctly prepared, may offer localized relief from inflammatory responses in leg muscles. Historically, rosemary has been esteemed for its diverse medicinal qualities across various cultures for many centuries. Ancient civilizations widely recognized its utility in treating numerous ailments, including those specifically affecting the limbs. Traditional herbal medicine frequently incorporated rosemary for its invigorating and restorative effects on tired legs. This long-standing tradition of use underscores its enduring relevance in contemporary natural wellness approaches. Its historical application provides a strong, reliable foundation for its modern use in comprehensive leg care. For many older adults, maintaining robust leg health is paramount for preserving independence and daily quality of life. Rosemary oil can serve as a gentle, natural aid for tired, aching legs after extended periods of standing. It may also help to ease the discomfort often associated with common age-related leg issues and complaints. Consider its thoughtful use as part of a comprehensive, holistic strategy for achieving leg comfort and well-being. Proper dilution with a suitable carrier oil and preliminary patch testing are always recommended before widespread application. Consultation with a trusted healthcare professional is advisable, especially when managing pre-existing health conditions or concerns. This document outlines a structured 7-day regimen for utilizing rosemary essential oil in leg care. This protocol is designed to promote leg comfort and support leg wellness through consistent application. Rosemary oil has long been recognized for its potential invigorating and soothing properties when applied topically. Before commencing, it is advisable to select a high-quality, pure rosemary essential oil for optimal results. Proper dilution with a suitable carrier oil, such as jojoba or almond oil, is crucial for safety. A general dilution guideline is 2 to 3 drops of rosemary oil per teaspoon of carrier oil. Prior to widespread application, conduct a patch test on a small, inconspicuous skin area to assess sensitivity. Apply the prepared oil mixture to clean, dry skin, ideally after a warm bath or shower. The regimen involves a specific upward massage technique, moving from the ankles towards the upper legs. Employ gentle, consistent strokes to encourage absorption and support the leg's natural circulatory processes. Focus particular attention on areas prone to fatigue or discomfort, applying with gentle, mindful pressure. During the initial 7-day period, this application should ideally be performed twice daily, morning and evening. Consistency during this introductory phase is important for observing potential benefits for your leg comfort. To potentially enhance the effects, consider elevating your legs for approximately 15 to 20 minutes post-application. Resting with legs elevated may further assist in promoting comfort and reducing sensations of leg heaviness. Maintaining adequate hydration throughout the day also contributes positively to overall skin health and bodily function. Individuals with pre-existing medical conditions or known skin sensitivities should consult their physician before starting. This consultation is particularly important for those taking medications to avoid potential adverse interactions. Discontinue use immediately if any adverse reactions, such as persistent skin irritation or increased discomfort, occur. Observe your body's response attentively throughout the 7-day period and adjust practices as deemed necessary. Some individuals may experience a mild, temporary warming sensation, which can be normal with rosemary oil. Over time, consistent application may contribute to improved skin appearance and a sense of leg revitalization. This protocol is intended as a supportive self-care measure, not a substitute for professional medical advice. Following the initial week, application frequency can be adjusted based on individual preference and observed results. Continued use, perhaps once daily or several times per week, may help maintain desired leg comfort. Patience and adherence to these guidelines are important for evaluating this regimen's personal suitability. This structured approach to rosemary oil application aims to provide a focused experience for dedicated leg care. Remember that individual outcomes can vary based on numerous personal factors, and consistent, careful application. Ensure the chosen rosemary oil is authentic and sourced from a reputable supplier for best practice. Store both rosemary and carrier oils in cool, dark places to preserve their integrity and efficacy. This document outlines a prospective timeline for a 7-day wellness protocol designed to support your body's natural processes. Individual experiences will invariably differ. On the initial day, many report a subtle shift, often described as an awakening or a renewed sense of awareness regarding their physical state. This first day emphasizes gentle adjustment and attentiveness to your body as you embark on this structured approach to personal care and well-being. By the second day, some participants may observe early physical indications of change, such as a potential reduction in minor swelling or puffiness. These initial responses can be encouraging, suggesting the body is adapting positively to the protocol's supportive measures and renewed focus on health. Moving into the third day, a gradual increase in perceived energy levels might become apparent, contributing to a greater sense of vitality throughout daily activities. Some individuals also note improvements in digestive comfort as the body continues to adapt to the protocol's structured guidelines for enhanced wellness. The fourth day often marks a point where sustained energy becomes more consistent, rather than fluctuating, as it might have previously done for some. Improvements in sleep quality, such as experiencing deeper or more restful sleep, are also commonly reported around this midpoint of the wellness journey. By day 5, further physical enhancements may be noticed, potentially including increased ease of movement or a greater sense of physical lightness and comfort. A more positive outlook and an uplifted mood can accompany these physical improvements, fostering a greater sense of overall well-being and contentment. The sixth day often involves a consolidation of the benefits experienced earlier, with individuals feeling more robust and invigorated in their daily lives. There may be a growing sense of accomplishment and empowerment as you approach the conclusion of this dedicated 7-day period of focused self-care. On the seventh and final day, you can reflect upon the changes experienced, appreciating your commitment to this focused period of personal wellness. The aim is for a renewed sense of vitality and a better understanding of your body's capacity for positive adaptation and sustained improvement. This structured week serves as a foundation, encouraging the adoption of sustained healthy practices